Welcome to Reversing Hashimoto Show. I'm your show host, Dr. Anshul Gupta, the world expert in Hashimoto's disease. I help people reverse their thyroid conditions by making personalized functional medicine plans. You can work with me with any part of the country now by making virtual functional medicine appointments. To book an appointment, look at the show notes. In this show, I am going to get experts from all over the world who are going to share latest information that will help you to reclaim your life back from dreadful thyroid disease. So welcome here. And today we have Dr. Eric Osansky over here with us. Welcome over here.
Thank you. Thank you so much, Dr. Gupta. Appreciate you having me here.
Oh, it's our pleasure. Let me introduce you first. So Dr. Eric Osansky is a chiropractor, clinical nutritionist, and a certified functional medicine practitioner who helps people recover from thyroid and autoimmune thyroid conditions. He's author of the books Natural Treatment Solutions for Hyperthyroidism and Graves' Disease and Hashimoto's Triggers, and is a host of the Save My Thyroid podcast. He was personally diagnosed in 2008 with Graves' disease, and after taking a natural treatment approach, has been in remission since 2009. After seeing how well natural treatment methods helped with his condition, he began using these natural thyroid treatment protocols to help others with different types of thyroid and autoimmune thyroid conditions, including hyperthyroidism, Graves' disease, hypothyroidism, and Hashimoto's thyroiditis. Wow, welcome over here, Dr. Eric.
Yeah, thanks again. Thanks again, Dr. Gupta. Look forward to this interview and hopefully sharing a lot of valuable information to the listeners.
Oh yes, I'm like always looking for good information, and I'm looking for today's because I think a lot of people want to know about antibodies in Hashimoto's and Graves' disease and how to improve them. So we will talk about all of that stuff. But before that, I would like to hear your story of, how you went to this autoimmune thyroid condition of Graves and how you were able to heal from it. So if you please can share that with us.
Sure. So as you mentioned, in 2008, I was diagnosed with Graves' disease, initially hyperthyroidism. Then I went to an endocrinologist and she tested the antibodies that we're going to talk about. And in my case, what's called the thyroid stimulating immunoglobulins were elevated along with the hyperthyroid condition. And that's diagnostic of Graves' disease. And I knew right away I was going to take a natural approach. Now, I wasn't confident, honestly. I was a little bit skeptical and nervous about whether it would work because at that time I didn't know anybody specifically with Graves' disease who had restored their health. But long story short, I just changed my diet. My being a chiropractor, I felt like at the time I was eating well, but then looking back, definitely was room for improvement. Did things to manage stress, and took some supplements. Just made a lot of diet, lifestyle changes, certain supplements. Did some testing to find some of my triggers, and we'll I'm sure talk about that during this interview here. Yeah, definitely a scary process as it is with anybody with I think any autoimmune condition. And again, even though I was a natural health, still am a natural healthcare practitioner, but, I was, like I said, I was skeptical. I wasn't sure if it would work, but I knew that the conventional approach with both Graves and Hashimoto's is to treat the thyroid, and this is more of an immune system condition. So 2008, I was diagnosed, and that in 2008, 2009 is when I was on my journey. And as you mentioned, I've been in remission since 2009. From Graves' disease.
Wow, that is amazing. I'm sure a lot of people will feel relieved, by hearing that there are natural methods, by which you can go into remission. So that is great. So now let's talk about, like these autoimmune thyroid conditions, because I think there is a big spectrum of these autoimmune thyroid condition. And let's kind of, clear some of the terminology so people have a better understanding. So autoimmune thyroid conditions, that we're talking about here is Hashimoto's, as well as, the second one is the Graves' disease. So why don't you tell us a little bit more about those, like how they are different and how they are kind of also similar at the same time?
Sure. So as you mentioned, they're both immune system conditions, autoimmune conditions, and that's a big similarity. But they symptom-wise and thyroid hormone level-wise, they present in different ways. So with Graves' disease, that's typically associated with hyperthyroidism, where you have a depressed TSH, which is thyroid stimulating hormone, and that's a pituitary hormone. And then you have the thyroid hormone levels, the free T3, free T4, the thyroid hormones. And so these are commonly elevated with hyperthyroidism. And then with Hashimoto's, sometimes you get thyroid hormone levels lower. Sometimes they're more subclinical, where they're within the normal range, or at least the lab range, but many times not within the optimal range. And so, but the TSH is commonly elevated in Hashimoto's, and it could take years for that to reach that point. Most of the time, I would say, if not all the time, there's that underlying autoimmune process that takes years to develop, or at least years to show on a thyroid panel. So someone might develop antibodies, and it might take 5, 10, 15 years for the thyroid to be affected. And most practitioners won't test the antibodies. So again, hyperthyroidism with Graves', hypothyroidism with Hashimoto's, or many times subclinical hypothyroidism with Hashimoto's. And then the antibodies differ. So I don't know if you want me to yet get into the different types of antibodies and link them to.
Yeah, let's talk about the antibodies at the same time.
Sure. So first of all, what is an antibody? So an antibody, it's a Y-shaped protein that is part of an immune system response to an antigen. And an antigen is a foreign substance that causes an immune response. And, examples of antigens could include, food proteins, pathogenic bacteria, even chemicals. And so with autoimmunity, the antibodies bind to the body's own tissues, but they don't cause damage to the tissues. And so with Hashimoto's, you have either what's called TPO antibodies, which are thyroid peroxidase antibodies, and or anti-thyroid globulin antibodies. So TPO antibodies are the most common type of thyroid antibody. And you also see those in many cases of Graves' disease as well. When I dealt with Graves', I actually did not have the TPO antibodies, but I do see it a lot in my Graves' disease patients. But very common with Hashimoto's, the statistics show like 80 to 90% of people with Hashimoto's have the positive TPO antibodies. And so TPO, or thyroid peroxidase, is an enzyme that's important in the production of thyroid hormone. So when you have those elevated TPO antibodies, that indicates that the immune system is damaging this process, which over time can lead to hypothyroidism. And the anti-thyroid globulin antibodies, so those are more specific to Hashimoto's. So not everybody with Hashimoto's has those antibodies. So I guess to summarize, with Hashimoto's, typically it's diagnosed by elevated TSH and either elevated TPO antibodies or thyroid globulin antibodies. So you only have to have one of those elevated, but many people do have both of those elevated. And then Graves' disease, you have the elevated thyroid stimulating immunoglobulins, or TSI, which is a type of TSH receptor antibody. This is what I had. This is the antibody I had. And again, that's very common with Graves' because that's what's diagnostic. But as I mentioned earlier, a number of people with Graves' also have the TPO antibodies. So if someone, again, has low or depressed TSH levels, elevated thyroid hormone levels, and elevated TSI, thyroid stimulating immunoglobulins, then that's typically diagnostic of Graves' disease. Some people have subclinical Graves', not as common as subclinical Hashimoto's. So with subclinical Graves' disease, you'll see TSH depressed and elevated TSI, but you'll see normal thyroid hormone levels. And those are the main differences as far as testing goes, what you would see on a thyroid panel and looking at the antibodies. And then the symptoms also are different. So what the symptoms, with hyperthyroidism, when I dealt with hyperthyroidism, I had an elevated resting heart rate, heart palpitations, and I lost a lot of weight, lost 42 pounds, had a voracious appetite, and had some tremors and some looser stools, which are common. And some people have what's called thyroid eye disease, which is related to more the immune system than the hyperthyroidism. And then with Hashimoto's, some common symptoms, as you're well aware of: fatigue, brain fog, weight gain, coldness, some of the more common ones, constipation. Of course, there could be, many other symptoms with both of these conditions. And, where again, they are similar, is that they're both autoimmune conditions that affect the thyroid, even though they're affecting the thyroid in different ways. The reason why someone has antibodies I mean, there's a few different ways, and we'll get to it, but that the triggers are very big, which is why I wrote a book, Hashimoto's Triggers. And you of course talk about it too in your book as well. And when dealing with your patients, you address the triggers. And we could of course chat about those. But those are essentially some of the similarities and differences between Graves and Hashimoto's, which of course we could expand on even further.
Awesome. I think that's a great kind of summary about, so people have understanding about how the autoimmune diseases are there, and especially focusing more on the antibodies, as you said, because not a lot of people know that, these antibodies are present, and with simple lab tests, each and every labs, can do it. So, that's a good part about it. The other question that a lot of people actually have is that why suddenly, like my body is producing antibodies? Obviously, the conventional medicine has no answer for it. No reason, according to them, that why your body produces antibodies. So tell us a little bit more about it, that why, like antibodies are being produced.
Sure. Well, there are both genetic and environmental factors. And it's important to say that not everybody who has a genetic predisposition to any autoimmune condition, not only Graves' disease or Hashimoto's, but rheumatoid arthritis, multiple sclerosis. A lot of people have that genetic predisposition, but they won't necessarily develop this condition. So there's something called the triad of autoimmunity, which really explains why autoimmunity develops. And the three components of this triad, one of them is that genetic predisposition. And unfortunately, we can't change this, but the good news is we can positively affect these other two components. The second component is exposure to one or more environmental trigger. And again, we could talk more about the different triggers. And then the third component is an increase in intestinal permeability. The medical term that's a medical term, and the term everybody's familiar with is a leaky gut. So that's also known as increase in intestinal permeability. So if someone has that genetic predisposition and then they're exposed to a certain environmental trigger in the presence of a leaky gut, then that will set the stage for autoimmunity. And that's essentially how autoimmunity develops. There's other factors like what's called regulatory T cells, which help to keep autoimmunity in check. And if you have a decrease in those Tregs, or again, regulatory T cells, that also can make someone more susceptible, but you still have to have that triad in effect. Again, that genetic predisposition, exposure to one or more triggers, and that leaky gut.
Absolutely. So that's great. So out of those three, as you mentioned, genetics, we don't have much control over it. Basically, it's the genes, right? But I think the other two we do. I mean, in other interviews, we have already spoken about leaky guts. Let's talk about the triggers a little bit, like what kind of triggers, the environmental triggers that you see that people get exposed to and can lead to the production of antibodies.
Sure. So there are different types of triggers. There's different categories of triggers. So food is definitely one of those components, one of those categories. And so most people probably who are listening to this are familiar with gluten being a potential factor. And most natural healthcare practitioners, most functional medicine doctors will recommend for people with different types of autoimmune conditions, including Hashimoto's and Graves', to avoid gluten, to strictly avoid gluten, because even in the argument, some people bring even a small amount of gluten will cause problems. And the truth is, it depends on the person. Some people might be able to get away with a little bit of gluten exposure, but there's really no need to eat gluten, no good reason to eat gluten or to eat foods that have gluten. And so really, ideally, want to try to be strict when it comes to consuming gluten, especially if you have something like a condition such as celiac disease. But even if you don't have celiac disease, it could still cause inflammation, contribute to that leaky gut as well, but also could be a direct trigger. And then dairy, corn. The literature also shows that salt, again, salt is associated, like too much salt, with high blood pressure, but the research shows it can increase what's called Th17 cells, which are associated with autoimmunity. So if you eat too much sodium chloride, that also could cause problems. And it doesn't mean you should cut out all salt from your diet. I do commonly recommend sea salt to patients, but you just don't want to overdo it. The bigger concern is like packaged foods. Most packaged foods have sodium in there. And so again, that could potentially cause problems. And then so food is that, one category. And then another category would be stress. So we all deal with stress. And, many times it's not really the stressor itself, but just our ability to handle the stress. And so while if you could reduce the stresses in your life, that's great. That's wonderful. Definitely try to do that. But if you can't, and many people can't reduce the stressors, either way, you want to focus on improving stress handling skill. And usually what I recommend is taking at least 5 minutes per day, every single day, to manage stress in some way, such as doing things like yoga, meditation, deep breathing, biofeedback. There's so many different techniques that you could use, and you just got to choose one that you're willing to do. A lot of people who utilize stress management techniques, they only do it, let's say 2 or 3 days per week. Maybe they do yoga a couple of days per week, or deep breathing, but you want to get into the routine of doing it daily. And that's why I usually recommend just starting with 5 minutes, because just about everybody could block out 5 minutes. And then once you're in the routine of 5 minutes per day of stress management, then you could gradually increase the duration to 10, 15 minutes, even more than that if you want. But just first get into that routine to doing it every day. And then, stress is a second one. Infections could be, including the current infection we're dealing with these days, other types of viruses and bacteria and parasites in some conditions, parasites in some situations. It really depends. H. pylori, which is, of course, in the gut, can cause problems. So infections and chemicals such as mercury could cause problems. Some of them might not be direct triggers, but glyphosate, which is one of the ingredients in the herbicide Roundup, that could infect the gut, negatively affect the gut microbiome, potentially cause a leaky gut, which is one of the factors of the triad of autoimmunity. So, and then xenoestrogens found in plastic water bottles, even like thermal paper receipts have BPA, and then there's other types of xenoestrogens. And so that's, so the chemicals would be the fourth. And, nutrient deficiency. So in your book, you talk about nutrient deficiencies as being like a category, like one of the categories of triggers. And, I guess I've always considered them as not maybe a direct trigger, but a contributing factor. But either way, nutrient deficiencies, if you're low in like selenium, like there's definitely studies that show that supplementing with selenium could decrease thyroid antibodies in some cases, and vitamin D, even though it's more of a prohormone than a vitamin, but still you want healthy vitamin Ds for a healthy immune system. And there's other nutrients that are extremely important. Others as well, like toxic mold, which would fall more under like the environmental toxin category, estrogen dominance. So what I mentioned isn't all inclusive, but those are some of the main categories of triggers, and I threw in a few specific ones as well.
That's great. And from what my understanding is that the triggers can be very common, for both Graves and Hashimoto's. It doesn't really matter which one you have, but the triggers can be very similar. Is that correct?
That is true. I mean, in the research, some triggers are more closely associated with Graves and others more closely associated with Hashimoto's. Like there's a case study that shows that blastocystis hominis could potentially trigger Hashimoto's. And there's nothing in the literature showing that it could trigger Graves. But I will say I've seen Graves patients with blastocystis, and that seemed to be the trigger, like when addressing the parasite, the person got into remission. But then there's also been cases where what seems to be the trigger, like the parasite, and the person doesn't get into remission, like their antibodies don't really change. And that's saying that there's something else going on. Like just because someone has H. pylori, which could be a trigger, or Epstein-Barr, it doesn't mean if they have it, it's definitely the trigger. So sometimes you do have to do more detective work, and sometimes you just got to see how the person responds. If someone has Graves and they have H. pylori, I'm usually going to treat the H. pylori. And, but there also might be other imbalances at the same time. So we might be treating the H. pylori, correcting nutrient deficiencies, focusing on adrenals, and hopefully the combination of that will help to, get the person in remission. And if not, then we might need to do further testing, or maybe retest, make sure that the adrenals look better, that the H. pylori has been eradicated, or really any infection that you're treating. So yeah.
That's great. Now let's talk a little bit about, you brought an important topic about, or interesting topic about salt, right? And that's where the associated thing about iodine comes into place. And, obviously everybody said what salt is best for me, sea salt or Himalayan salt, pink salt, or, iodized table salt. So where are you with all those things, especially, with the iodine, content? And Do you recommend people taking iodine supplements, or you are more on the side, okay, well, no, too much iodine is bad? What do you think?
Sure. So with the salt question, I usually recommend the Celtic sea salt, the CELTIC. Many, I'm sure, are familiar who are listening to this. And so that doesn't have the iodine, but yeah, if you get iodized salts, obviously that will. Now, is the small amount of iodine going to cause problems in people with Graves' Hashimoto's? I mean, in most cases, probably not, but it's refined. I like the Celtic sea salt. The main reason I recommend it, not just because of the, that it doesn't have iodine. I wouldn't be too concerned about that in the salt, but, also it has like all the minerals in there, and it's just a healthier form of sea salt. But question with iodine, I actually had a really good experience with iodine. So it's like one of those things where, to answer your question, I usually don't recommend iodine supplements because it could potentially be a trigger, or it could exacerbate Graves' or Hashimoto's. And I wrote about this in my book, Hashimoto's Triggers. But it's funny because when I dealt with Graves', I attended conferences. And back then, 2008, it was more pro-iodine. So they were like recommending like higher dose iodine. And even now, some practitioners recommend like really high dose iodine. But back then, I took higher doses of iodine. I did a urinary test, to see if I was deficient in iodine. And it's called the iodine loading test, which some people might be familiar with. And that actually involves taking iodine before doing the test and measuring the excretion over 24 hours. And again, I had a good experience with iodine. So I figured, everybody needs to test for iodine. And if deficient, take iodine, like supplement with iodine. So that's what I did for the first few years of practice. And again, I saw mixed results. I saw people who did fine with the iodine and people who got better. But to be fair, they were doing a lot of other things, not just the iodine. They were changing their diet, managing stress, finding, removing triggers, as we so far have mentioned. So it's hard to say, like I could say for sure it's not the iodine, because now fast forward, I'm more conservative with the iodine. Like I don't typically recommend iodine supplements. There might be exceptions, but there's definitely risk with iodine, like taking, especially like higher dose iodine. Like sometimes a person will come into my practice and they might see earlier articles I wrote like years ago when I was, more, and I'm still, I would say I'm not anti-iodine, because again, iodine is important. And some practitioners will say never, like if you have Graves' or Hashimoto's, never have iodine. And I don't necessarily believe in that, but I would be cautious, especially with iodine supplementation. And then even in some cases, very high food sources like seaweed, kelp, the sea vegetables might cause some problems. It depends on the person. I'm sure there are people, who are tuning in and are like, hey, I've taken high dose iodine and I know it's helped. And I had a goiter, like swelling of well, actually I did have a goiter, but just giving an example of like where I've had people just take iodine on their own and say, yeah, it helps shrink my goiter. But I've also had patients, and non-patients who said, that they took iodine and that was when their condition began, whether it's Hashimoto's or hyperthyroidism. And you just don't know what category you're going to fall into. So if you are going to do anything with iodine, definitely work with a practitioner. But, again, just be cautious, because there are still practitioners, like some, I mean, again, I don't want to say anything bad about other practitioners. That's, if they're having success with it, that's great. But I guess, again, like I said, I was one of those practitioners that was recommending a high dose iodine, and just, over the years have seen, or the first few years, because like I said, over the last, few years, I can't say that's standard in my practice. So yeah, it's a tricky situation, because some people are just anti-iodine or pro-iodine. I can't say I'm either one. Like I'm not anti-iodine. I'm cautious. I guess you could say I'm pro-iodine, because again, it's all the minerals are important, but I think you need to be cautious when it comes to separate iodine supplementation or eating, again, sea vegetables, foods very high in iodine.
Absolutely. I'm also on the same boat that, I think I'm in the middle. That's what I call myself. That, yes, we all need some amount of iodine, but we don't need tons of it. And as you said, it depends on person to person. So absolutely. So now the next question a lot of people have is that, can we reduce antibodies, right? Because again, when they have been to their regular doctors, they have been told that once you have antibodies, you don't reduce them, or they only reduce once your thyroid is completely destroyed. But you and me know that, okay, it can be reduced. So do you see that in your practice that the antibodies do reduce with the protocol that you work on the patients?
Definitely. And that's what happened to me when I dealt with Graves' disease. And, my antibodies, the thyroid stimulating immunoglobulins, they normalized. And over the years, I've helped many people with the antibodies normalize. Now, sometimes it's challenging. I don't want to make like it's always easy and you just change your diet and take a few supplements and your antibodies normalize. And sometimes it's a struggle. Sometimes you think you're doing everything. So, and I think that's the case with most practitioners. You got patients where, the antibodies, decrease and normalize, others where the antibodies decrease, but they don't normalize, and others where they're just kind of like a roller coaster, and it's looking better, on one test, but then it increases. And that's usually an indication that there's still, either you haven't removed the trigger or there's a lot of inflammation. One thing I want to mention is I like to try, of course, to get the antibodies normal, but there are other things also that are important, like, the person feeling well. And I mean, there are times when a person's antibodies might not normalize, and but they're feeling great. I guess the point is that even if they normalize, I don't look at it as a cure. Like I've been in remission since 2009, and I do test my antibodies annually just to make sure they're in check, but there's always a chance of relapse whether the antibodies normalize or not. So, but obviously it's great when you look at the thyroid panel and everything, thyroid panel and antibodies are normal, not just the thyroid panel. You want to dive into some of the reasons, or, what to do, like in order to decrease those antibodies then?
Yes, let's do that. I think everybody is waiting to hear about what they can do to improve and reduce those antibodies. So please share that information.
Sure. So we spoke about the triad of autoimmunity. As we both mentioned, you can't do anything for the genetics. And that's why I don't like to use the word cure, but you can do things to find or remove the trigger and heal the gut. I won't get into great detail with healing the gut because you mentioned that some of the other speakers focus on healing the gut. But when it comes to the triggers, I like to use testing. So I do prefer testing. Now, when it comes to food, I know that you do both, like an elimination diet, and you do. I interviewed Dr. Gupta, so I know everything about his practice and all that. So you do an elimination diet, you do some food sensitivity testing, and again, no method is perfect. So elimination diet is, I like elimination diet, eliminating the most common allergens and food that could affect gut healing. And so that if you do elimination diet, you don't have to do any testing for that. And again, maybe in some cases, you might eliminate major triggers doing that. And there are some people just doing that alone will get significant reduction of the antibodies, sometimes normalization of the antibodies, especially eliminating some of the ones I mentioned, so gluten, dairy, corn, salt. And, that's not to say other foods can't cause inflammation. Just according to the literature, those are the main foods that seem to be potential autoimmune triggers. People could react to any food, and that's the benefit potentially of food sensitivity testing is, maybe someone reacts to broccoli or something that is not part of an elimination diet, and they do the food sensitivity testing. I guess food sensitivity testing, they are a bit pricey, and then there's the chance of false results. But that's the reason you do both the elimination diet and the food sensitivity testing. And so definitely everybody at the very least should change their diet. And that's something that, again, people could do right away. You could do that today. You could do that, next week. Some people might want to set a date, like mentally, just say, okay, I'm going to start, doing it the first of next month. As far as the dietary change. And for some, it's more of a challenge than others. If someone's eating a lot of fast food and refined foods, be more challenging. They might have to just start eliminating certain foods slowly and then incorporating more whole, healthy foods, more vegetables. Stress. So let's move on to stress. So stress, again, that is something also you could do without testing. Although I will say I do like adrenal testing. I'd like to do either adrenal saliva testing or dried urine testing, such as a Dutch test. That also, both of those tests look at the circadian rhythm of cortisol. Cortisol should be at the highest in the morning, gradually decrease at the end of the day. And, you could do a blood test, but it's only going to look at a single sample. And so, stress management, even if you don't do testing, you can do that on your own. But when it comes to certain supplements, I base that on the pattern. So I don't have one protocol for everyone for like adrenals. Like when I dealt with Graves' disease, I did an adrenal saliva test back then, and everything was low. My cortisol was low, my DHEA was low. And, there was a few other markers on the test I did that was low. So in my case, I took licorice root, which is not a good fit for everyone. If you have high cortisol, you probably don't want to take it. If you have hypertension, high blood pressure, that's contraindicated. And, I took nutrients as well, B vitamins, vitamin C. Some will take adrenal glandulars, especially if they have like lower adrenals. And then if someone has higher cortisol, agents such as phosphatidylserine, Relora. Some people take ashwagandha. There's some controversy with ashwagandha and thyroid health. It's a member of the nightshade family. So if someone's following like autoimmune paleo, they might do perfectly fine with ashwagandha, but you probably want to know that it's a part of the nightshade family. And maybe you do want to avoid that. Well, if you're following strict AIP, strict autoimmune paleo. And then some people with hyperthyroidism, the ashwagandha could affect the HPT axis, the hypothalamic pituitary thyroid axis. And some may feel, become actually a little bit more hyperthyroid. Again, I don't see it too commonly, but some people do experience that. The good news is when you stop the ashwagandha, typically those symptoms stop. But ashwagandha, overall, I love ashwagandha. And so just mentioning some of the, I guess you could say, potential risks. And so doing testing is a big part of my practice. I just mentioned some things you could do on your own. I mentioned some of the testing, like adrenal testing. There's comprehensive stool panel, like if you want to look in the gut deeper and see if someone has H. pylori or parasites. I mean, you could test for H. pylori by itself, but the comprehensive stool panels look at a lot more and give a lot more information. And, if you suspect you have toxic mold, you might want to test your house for mold, but there's also urinary panels to see, the levels of mycotoxins you have in your body. Again, nutrients, testing for nutrients, especially vitamin D. It's sometimes hard to test for nutrients. I think you use like the NutriVal and there's SpectraCell. So those are options. Some of these you could do in the blood at your local lab, like an iron panel, vitamin D. You could definitely, do locally, RBC, magnesium, but some of the others are more challenging to test for. And, again, chemicals are challenging too. There's, hair testing, there's urine testing, blood testing more for acute heavy metals. And then there's like one called the GPL Tox from Great Plains Lab, looks at different markers, different metabolites related to chemicals. Problem is there's too many chemicals to test for. Cyrex Labs, I think you use Cyrex Labs for some testing. They have like their array number 11, I think it is, which measures the immune response to different environmental chemicals, whereas most other tests are looking at the levels. But if your immune system is reacting, then you definitely are having a problem with the chemicals. But you don't want to go crazy with the testing. I will say that. So I like to use testing to try to find triggers, but I don't recommend thousands of dollars worth of testing to my patients. I'm actually very conservative. I start with just a few tests. At least that's what I recommend. Sometimes a patient wants to do more testing, and if they really want to, that's fine. But I'm more conservative. And if we find, what I think are some potential triggers, we'll look to address those. And then if the person's health improves, the thyroid panel improves, other areas improve, the antibodies decrease, then again, we don't need to do further testing. If things aren't improving, then we, again, that's where I'll look into doing other testing. Of course, making sure the person is following the recommendations. So yeah, I mean, to summarize kind of like how to lower antibodies, it's simple, but it's not simple. The simple part of it is you got to find the triggers and correct other underlying imbalances, and then, pretty much address the triggers and, again, underlying imbalances. And then when you do that, most of the time, the antibodies will decrease. And usually it is a gradual process. It's not like 1 month later, antibodies are high and then, they're normal. Usually it does take some time. But if they're not improving, so what happens if, some people, again, I'm sure they're tuning into this and, they're thinking, well, I've already, I'm following a great diet, whether it's autoimmune paleo diet or regular paleo diet or ketogenic, I'm eating really well, I'm managing stress. And, I've already done some testing. Maybe some people, I'm sure, watching this have seen other natural healthcare practitioners. and still I'm not feeling 100%. And, antibodies, still are, not where they need to be. Maybe they have decreased a little bit. Maybe they haven't decreased. Maybe they decreased a lot, but they're still pretty high. If someone has thyroid peroxidase antibodies of 800 and they're now 300, that's still well above the reference range. And like I said, you don't want to get too caught up on antibodies, and I get caught up because I want to see them normalize. But, again, if they're not decreasing, then that's when I usually will say, let's dig deeper. And that's up to the patient. The antibodies might still not be normal, but they're feeling so much better. And, everything else is better, but the antibodies. But I will say a lot of people want to go further and see, are there anything else they could do? And usually there are other things, because like I said, I usually start conservatively. And if they have been to another practitioner before seeing me, again, there usually are things that the other practitioner hasn't done. And I'm sure same thing with you, when they see, if they've seen another practitioner, they usually haven't done everything. And, you're pretty comprehensive in what you do. So yeah, do you have anything to add to that? As far as lowering antibodies?
I think that is a very comprehensive list. I always believe that, if the antibody levels are not improving or the patient is not improving, then there is certainly an underlying trigger that has not yet been addressed. So that's what I believe in, and as you said, we all work on these triggers on a different fashion or different plane. And I think you currently pointed out was that we just have to dig deeper. So I think that's what in the end is needed. If for some reason that patient is not moving in the right direction, then I guess we just have to all dig deeper into finding that why. That's what I do. Is maybe that's what it looks like you also do the same thing.
Yeah. And again, like I said, I don't want to elaborate too much on the gut because other people have done that. But again, maybe you found the triggers, but the gut still hasn't been fully healed. And you need to find the trigger specifically to the gut. What maybe something is specifically affecting the gut. Maybe you're still getting exposed to, more glyphosate than you think you're getting exposed to, or, another chemical, or you have a hidden gut infection. So again, healing that gut. And just, I'll say one thing about healing the leaky gut. A lot of people focus on reinoculation with probiotics, just replacing with digestive enzymes, repairing the gut. They'll drink bone broth. And those are all, all could be beneficial, but they don't focus on removing the factor that's causing the leaky gut. So they're just, taking probiotics, maybe prebiotics, a digestive enzyme, taking L-glutamine or drinking bone broth. And they're like, I'm doing everything I can to heal the gut. But what is causing that leaky gut? If you don't remove that factor, maybe you're getting exposed to gluten and you just don't know it. Or again, hidden gut infection is common. I've had countless patients who didn't have digestive symptoms, and yet they, had H. pylori or, parasite. And some will argue, well, if it wasn't causing symptoms, maybe not address it. And again, that's another debate, I guess, maybe for another time. But again, if the antibodies, especially if they're not decreasing, and we've done a number of things, and then we do testing and find, gut infection, and then maybe they're like, oh, my gut feels fine. But sometimes you will get other symptoms outside of the gut. Maybe you'll get some brain fog or, fatigue. So you can't always assume that H. pylori is going to cause heartburn and parasites are always going to cause diarrhea, so and so. But so I'll just say that you want to make sure your gut is healed and make sure to address the factor that's causing the leaky gut.
I agree with that. Gut is such an important thing. And sometimes I just go back to the gut. After I have done a lot of things and still people are not getting better, I said, let's go back to the gut and see if we have addressed each and everything. And you currently pointed out that a lot of people say, well, my gut feels really good. I said, well, let's just look. Because sometimes by looking, we can find stuff like parasites or a virus or an infection or a bad bacteria or H. pylori. You just never know. So definitely, yes, I think we all can do better with gut healing. So that is definitely a good point. So gosh, I think we covered a lot of good stuff over here, like a lot of good things that people can do at this point of time to improve their antibodies. The important point over here, I just want everybody to again remember is that you can reduce antibodies. Whether you have Graves or Hashimoto's, do protocols and do things, you can reduce antibodies and that safeguards your thyroid. So that is a message that I would just want everybody to remember that. So I think we covered a lot of good information. If you have any other things which are left that we have not yet covered or you want to share that?
Yeah, that's as far as lowering antibodies, that's, pretty much it. Talk about the triggers And I guess the only other thing I will say when it comes to the triggers, which again relate to the antibodies, is we spoke about gut infections. Sometimes the challenge is you'll do a comprehensive stool panel and they might come back negative. So again, we spoke about the food sensitivity testing also, being not 100% accurate. The truth is that no test is 100% accurate. So there's always room for, some more than others, but you might do a test and it might come back negative. And it might be due to the test itself, maybe just that day, the technician who was working on it, or again, just like Paris. We don't think about that, but I actually learned that at a conference. There was someone who worked for one of the labs. I think it was Genova Diagnostics. And not to say that I liked the lab, but just saying, they were saying sometimes they used to work for Genova. I think they were someone who worked with the testing. And they said, sometimes it depends on who's there. Because once you send in a stool sample, it has to go through a process where they look to, it depends if it's DNA-based stool testing or other types. But either way, there's some mix up in the procedure or something like that, potentially it could come back with a false negative. But even if they do it perfectly, somewhat parasites sometimes can be difficult to detect, even with something like I use the GI map, which is, more DNA based than the quantitative DNA, but still you could have false negatives with that. Again, that's why you want to work with a practitioner. I guess I'll leave it like that. If you're trying to do it on your own, which hopefully you're not, because people these days can order their own tests, just like they can, of course, order their own supplements. And if they're like, oh, I did all these tests, or maybe you went to another practitioner, they did a gut test and they said, oh, everything's fine. And sometimes maybe I'm not a big fan of treating without seeing on the test, but sometimes it is necessary. So I guess that's the one other thing I will add. And yeah.
Awesome. Great. Now, can you share, I'm sure a lot of people would like to know where they can find you. So please share where people can find you.
Yeah. So I actually have two websites now. So my main website is naturalendocrinesolutions.com. But as Dr. Gupta mentioned earlier, I do have a podcast called Save My Thyroid. You could visit the website savemythyroid.com and click on podcasts, or you could go to Apple Podcasts or Spotify and just type in Save My Thyroid. Then also I have a thyroid checklist, which you can access at thyroidchecklist.com. And it's multiple pages where it goes into more detail about the different triggers, which again are associated with the antibodies. And then one more, or I guess two more resources, my books, as he mentioned, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease and Hashimoto's Triggers. And again, you can find both of those on Amazon.
Awesome. Good. I mean, you have so many resources that each and every one can benefit from. So thank you so much. And thank you so much for sharing all this great information, and thank you so much for coming over here.
You are welcome. Thank you. Thank you so much. You're doing such great work. I enjoyed your book. It was a wonderful book. So definitely, if you haven't checked out Dr. Gupta's book, definitely do so. And again, thank you for this opportunity. I really do appreciate it.
Wonderful. Thank you so much.